This segment of Delmarva Life is brought to you by Delmarva Dental Services.
A trip to the dentist for a cleaning, it's pretty routine. In addition to having your teeth cleaned, your dentist will check your teeth for cavities or other issues that require attention.
But the exam is not always limited to your teeth. They may be checking for something else, something that could be deadly. We're talking oral cancer. Dr. Liaki, a dentist with Delmarva Dental Services, is here to explain this vitally important screening. Thank you so much for joining us.
Thanks for having me.
Okay, so we're talking about a screening for oral cancer. Is this something that's part of every exam at Delmarva Dental Services?
Absolutely, absolutely. So we are definitely looking at your teeth, and everybody thinks that's why they're coming to the dentist. We're checking your gums, but we're also looking at all parts of your mouth, outside your mouth and inside, tongue, cheeks, lips, roof of your mouth, floor of your mouth, and even back to the tonsils, and maybe even feeling your neck and back to your joints too. So we're checking a lot of things.
So what's involved in that? Just generally looking?
It's looking, it's having you stick your tongue out, and some people really don't like that, but we grab the end of it with a little piece of gauze so that we can really pull it to one side, and then the other look on the floor of your mouth, really being able to check and see down your throat as well as best we can without a scope or something more like that. And then we're also feeling for anything that feels tender or sore to you or feels unusual to us, like it might be swollen or something out of the ordinary.
And when you do the x-rays, again, you're not just looking at the teeth, you look at other abnormalities?
Right. So most people think, I don't need x-rays, I don't have a history of having cavities, it's not a big deal. But yes, we see cavities on x-rays. Yes, we see abscesses on x-rays. We can check your bone and your gum health looking at periodontal disease on your x-rays, but we can also see some cysts, tumors. Some of our newer x-rays, so the 3D scans allow us to look at sinuses and the TMJ or the joint here. And some of our panoramic x-rays might actually even show us calcifications in your carotid artery. So there are a lot of things that we can see that you may not think that your dentist can help you with.
So if you find an abnormality, that doesn't necessarily mean cancer.
Absolutely not. So please don't misunderstand that every time we say, oh, and let's talk about this, means that something is horribly wrong. We see a lot of things that are normal, and not every person is the same. Nobody's identical. People are unique. We look at people's mouths all day long. Your dentist, your hygienist, your dental assistant, and most people fall somewhere within the realm of normal. But it's when we see something that really jumps out at us, or that's a change in your mouth from the last time you were there or 2 years ago, that we say, maybe we should look at this a little bit closer.
And you even see things like where people kind of bite on their cheeks or their lips and things like that?
Yes, I mean, it could be all kinds of things. So it can be stress-related, you can have hormone-related changes, we see viral changes, cold sores, we see trauma-related or stress-related changes, ulcers, we see autoimmune changes like lichen planus. It's like a lacy white red patch that can be on the cheeks or gums that can be very painful. And then we also see fungal infections. Yeast infection, Candida, is called, it's like a yeast infection inside the mouth, many times caused by antibiotics or steroid use. So there's a lot of things. They don't mean that you have oral cancer, but there are things that we see that we can help you treat.
What do you see, or what do you look for when it comes to smokers?
So smokers, the most common things that I would say we would see would be nicotine stomatitis, which is actually on the roof of the mouth or the palate, and it's inflammation or sores up there, typically asymptomatic and often resolves if you would stop smoking, which I know is very hard to do, but it's actually not caused by the nicotine, it's caused by the heat from the cigarette or the tobacco, the pipe, whatever it is. And then we also see with people that use smokeless tobacco, we see gum recession and we see white folds in the cheeks, because most of those people stick that wad of chew right down in the same spot every time, and so we're looking for that, and also monitoring it to make sure that it doesn't become ulcerated, painful, or change over time, in which case we would need to address something more.
And that's what I wanted to ask you about. What if you do find something that does concern you? What do you do?
Call a dentist. I mean, for one thing, just call. You can start with your physician. We have some patients that come to our office because they didn't have a dentist. They've seen their physician about something. Their physician says, go to a dentist, have them check this for you. But what we're doing is we're asking a history. So if you have a lesion on the side of your tongue, but you say, oh, you know what, I bit my tongue 5 days ago, I know exactly what happened. It's not really as much of a red flag, but we may still say, hey, you know what, come back in a couple weeks, let's just make sure that's gone. We may take a photograph of it, we may x-ray it if something that we think is swollen in the jaw or something else unusual, and we may measure it. That kind of thing, just to keep track so that we can record any changes that are occurring and then direct you properly if we need to do a biopsy or further testing.
You make it sound so easy.
Yeah. If you're
you so
concerned,
much.
get
Thank you.
checked out. Thank you
That's right.
so much,
Thanks.
Dr. Aki. All right, if you would like to read more about Delmarva Dental Services, go to our website, delmarvalife.com.